we now have the wonderful privilege of, I believe, Carey Lloyd is the original plant-based physician in northern Utah. I believe that. I don't have any evidence to refute that. I've really looked up to him after meeting him and kind of his mentorship as well. He is a world-class pediatrician right here in northern Utah. So let's give it up for Carey Lloyd.
Well, thanks. Good afternoon. How's everyone doing? Doing all right? Hopefully we got our legs stretched. I'm honored to be here and to talk about what I really enjoy doing. And hopefully in doing so, I can help you in some ways and teach you about what I've learned about lifestyle medicine, and if the very least, have you start asking questions about yourselves and your lifestyle as well as your future practices. Inevitably, when I'm asked to talk and use my medical training, one of my daughters will ask me, gee, do they really want you? They want a real doctor, not a pediatrician. And so I was fed up with that, so I showed her my medical degree and made sure that she saw that, I was legit. Here are my disclosures, none. I eat food, mostly plants, but I'm not a nutrition expert. Here are the objectives. Let's understand, to help us to understand why lifestyle changes are needed in children. Explore and demonstrate simple hacks, if you will, or tools, programs, etc., in a busy practice to start that conversation about lifestyle in our patients. And then briefly discuss how lifestyle influences our past, present. Lifestyle influences children past, present, and future. To better understand why it influences our children, let's first look at who I am and why I'm standing here talking to you today. I'm a board-certified pediatrician. I've been practicing for nearly 30 years in Brigham City as well as now in Far West. And once you start into this, boy, you'll go a lot of different places. And so how did I get here? And more importantly, what were my past lifestyle choices and how did they affect why I'm here today? So here I am, living the American dream, vacationing with my family on a beach somewhere, doing my best imitation of Sasquatch, and also enjoying the standard American diet, consuming double cheeseburgers with bacon, fries, fry sauce, getting those chips from the physician lounge, eating white meat because, it's healthier, right? And then drinking 3 glasses of milk, 1%. Then putting off the plenty of juice and then putting off the fruits and vegetables for later. And what's a salad if it's not Jell-O salad? The problem is that ignorance is no protection for the consequences of inaction. And so what I was ignorant of was that my lifestyle choices were having consequences for me. Here I am sporting a BMI of 25, so I'm overweight, working greater than 60 hours per week. I still do, but relatively inactive. Exercising, I started having exercise-induced asthma, morning joint stiffness, as well as 6 hours of sleep on average, priding ourselves, which we commonly do in our practice because we've been trained during residency to do so. I had seasonal affective disorder and chronic stress, which I failed to realize was part of the reason we were living in a culture that was slowly consuming me with my lifestyle choices. Robert Allen stated, our culture today is a poisoned well. Our efforts and our money to go to treat the results of our illness culture. We have looked at disease so long that we have forgotten about health. Health is largely a function of when people take responsibility for their actions. Promoting and restoring health, therefore, has to do with attacking the causes of our modern diseases, and that can only be through education, motivation, and cultural transformation. Dr. David Bowman stated it this way: the real problem may be less that these health problems genetically run in the family and more that no one runs in the family. As a matter of fact, most of us are probably doing diddly squats as our exercise. The other thing is that what we inherit more than our genes is our cookbook. And the cookbook that's passed down has a bigger role in our health than does our genetics. So what I needed was a reality check. Someone once said, pride makes us artificial and humility makes us real. Then Harry Emerson Fosdick said, the beginning of worthwhile living is thus the confrontation with ourselves. My reality check and confrontation came when I watched this documentary serendipitously, after which I stood up and did three things. I asked, why in the world did I not learn this in medical school? 2, I believed the science that was presented because it was too powerful to not be legitimate. And then after that, I changed my diet and ultimately my lifestyle from that moment on. I started studying everything that I could, reading these books, just a handful of the ones that I chose. And I started attending the conferences, the International Plant-Based Conference, joined the Plantation Project. We heard about Dr. Barnard's Physician Committee for Responsible Medicine, learned about Dr. Greger's Facts, nutritionfacts.org, and the Food Revolution with John and Ocean Robbins. After changing my diet, within 6 months I had lost 20 pounds. By year's end I had lost 30 pounds. My BMI had dropped to 21. My exercise-induced asthma was resolved. My morning stiffness resolved. Seasonal affective disorder resolved. Chronic stress I'm managing a lot better, and started getting more sleep. I had increased mental clarity, renewed vigor, and a new purpose in what I was doing in my practice. I, for the first time, started to realize, gee, I'm hopefully going to make a difference. So it's amazing where we'll go. Then I joined the College of Lifestyle Medicine 3 years ago, and became board certified in lifestyle medicine 2 years ago. So what does this have to do with why lifestyle changes are needed in our children? This is best said, I think, summed up by James Baldwin, and he said, children have never been very good at listening to their adults, but they have never failed to imitate them. All things are delicately interconnected. Our children are innocent bystanders and direct targets of a business-as-usual culture that is unhealthy and poison. And because of that direct interconnection with them, we are training them up to imitate our lifestyles, and they will exceed the chronic illnesses that we are seeing today. And so let's look at some of those lifestyle changes that they're imitating and look at it through the lens of imitating us as adults. So we'll start with nutrition. As we've seen, 63% of the standard American diet comes from ultra-processed foods. Only 6% are coming from whole plants. If we look at what our children are eating over this period of time of 10 years, you notice there on the right upper column there, it's 67% of their calories are coming from ultra-processed foods. Teenagers, 80% of teenagers get less than 1 to 2 servings of fruits and vegetables each a day. And over 60-70% of them are drinking soda. This is where most of their calories are coming from. Then if we look at sleep, we can see that 30 to 40% of adults are not getting enough sleep, and 1/3 of people in Utah are not getting enough sleep. Think about that when you're out on the road. If we look at our children, it's been reported that 35% of our children 4 months to 17 years are reported as not getting enough sleep. If we look at the teens, 60 to 70% of junior high school and high school students, respectively, don't get enough sleep. This study done last year looked at 9 and 10-year-olds, comparing those who got enough sleep to those who did not, put them in the MRI scanner, and they noticed that those who weren't getting enough sleep had smaller brains in certain areas with decreased matter. So think about that with those 1/3 of adults out there they have smaller brains, or driving, or in sleep deprived. Emotional health. If we look at adults, 20% of us are suffering from some kind of mental illness affecting women more than men. If we look at our children over the last 10 years, and we all have seen this data, the COVID has really exacerbated this problem that has been there all along. We see that in all areas, especially suicides. Suicides have increased, doubled in our young girls. This is data from my office. You can see from 2016 up through last year, we had a 60% increase in our mental health visits. And worldwide, 16% of global burden of disease due to neuropsychiatric disorders. This is just not an isolated problem. So physical activity, let's see where we're at with that. 15 to greater 30% of adults are not getting enough physical activity. In Utah, around 15 to 20%, if we're telling the truth. And if we look at our kids, data show that an average decrease of 4.2% in total physical activity with each additional year. If we look at then the high school students, 44% say that in the previous 7 days they were physically active, getting some kind of heart rate elevation for greater than 60 minutes, 5 out of 7 days, leaving 56% who are not. So what are the consequences? We can restate Isabel Wilkerson's this way by saying innocence is no protection for the consequences of inaction in an unhealthy culture. So let's look at how that's affecting us. What are those consequences in the areas of diabetes, heart disease, obesity, and life expectancy in our children through the lens of imitating us? So there are over 100 million people, and it's closer to 50%, so 150 million people with diabetes or prediabetes in the United States. That's adults. We know that 1 in 3 people born after 2000 will have type 2 diabetes. I've actually seen that now, children born today, it's 1 in 2. And then there are some ethnic groups, it's 1 in 2. Then, if we look at what's happening in our kids, by 2060, in individuals less than 20 years of age, they will have a prevalence that will be 700% above what it is today if the current incidence of type 2 diabetes continues from what it has been from 2002 up to 2017. 700% increase. Heart disease, our number one killer, as we've seen. If you look at this map in adults, Utah, the darker the color, the higher the rates of mortality from heart disease. You see that we have the first and second highest rates of any other counties in the U.S., including Davis, Weber, and Morgan counties. As we learned earlier from Dr. Greger, these results, there's from autopsy results from the fetus who had spontaneous abortions, noted that in mothers that had high cholesterol levels, they already had fatty streaks in their arteries in utero. And we learned about the 10-year-olds, all of us have fatty streaks by age 10, and 37% of children who are felt to be not overweight already have 1 or more cardiovascular risk factors. So what about obesity? 70% of us are overweight or obese, and by 2030, half of the U.S. population will be obese. 1 in 3 children are currently overweight or obese. That's actually increased during COVID. It's now about 40% of our kids are overweight or obese, with about 20% of them being obese. That led David Ludwig to say, the obesity epidemic threatens to shorten life expectancy in the United States and bankrupt the healthcare system. So what is that life expectancy? Well, if we look here, the U.S. has the lowest life expectancy comparable to average countries. As a matter of fact, during COVID, we saw those life expectancies drop, and coming out of COVID in these other countries, that life expectancy is actually starting to go up, except in the United States, where it's continuing to go down. So let's look at our children. So we see that the life expectancy is dropping for various reasons, but then here in 2021, it is increasing in our kids from various sources. And over there on the graph on the right, you can see that it's going up, and COVID had very little to do with this. Guns are now the number 1 killer of children in the United States, and in some states, it's actually suicide. So the authors, seeing this data, said pediatric mortality rates also increase, which has ominous implications. A nation that begins losing its most precious population, its children, faces a crisis like no other. Vandana Shiva said, if you don't measure the well-being of your future generations, you're not measuring the true economy. This is America's grossest national product. In our current culture, our children imitate how we eat, sleep, exercise, and stress, and just like us, they are developing diabetes, heart disease, hypertension, and obesity, but unlike us, they will live shorter lives and cease to live while dying earlier than we are. Indeed, Vine Deloria said, the consumer society is indeed consuming everything in its path. Dennis Burkett stated, if people are constantly falling off a cliff, you can place ambulances under the cliff or build a fence on top of the cliff. We are placing all too many ambulances under the cliff. That's okay, we have short wait times, right? And we can all remember the helicopter wars we had about, who can land on Mount Everest. Then, former Robert Bloch said, we have a healthcare system in this country that is not salvageable. It is not sustainable. We can't keep spending money the way we're doing it. What we're doing isn't working. So let's look at building fences and explore and demonstrate applying some tools that can begin the conversation about lifestyle medicine. I first learned about this when I attended the Obesity Quality Improvement through the UPIC, and it was the Nemours 521 Almost None, which over the years has expanded to this 521 Almost None, which we call the prescription for health for our body, people, and our world. So then I added to that another handout that I give at each well-child exam with anticipatory guidance, and this is when I quoted the Great Wean, and we'll kind of go over this. I start with that at 6 months. And I tell parents, when we start feeding our kids, down there on the bottom of that graph, you can see that we start with these fruits, vegetables, the whole plant foods, and the healthy foods, and they have clean arteries. And then we start weaning over onto that right side of that artery, and they are more pro-inflammatory, damaging those epithelial layers of the artery, layering out the cholesterol and fat. And pretty soon, it's not an even playing field with the food manufacturers tainting those foods. Boy, they start turning their nose up and become picky eaters. And to try to help, I recommend this book, The Plant-Based Baby and Toddler, by these two moms, dietitians and nutritionists, have excellent recipes in there. And at a year of age, then I start with the 521 Almost None, 54321 Almost None. And we'll start with 5. I recommend 5 servings of fruits and vegetables on a daily basis, not to forget those legumes that we just learned about, at least 3 servings a day, whole grains and nut butters. Getting back to that question, children under 2 need 30% of their calories coming from fats. And then age-appropriate salts. Plants are the foundation of all health. I also recommend this book by Reshma Shah, Nourish, and Brenda Davis, who's an internationally known registered dietitian. She's amazing. And then we've heard about the Pediatric Plant-Based Nutrition Quick Start Guide from the Plantition Project. And then Dr. Greger's Daily Dozen. 4 is for minimum of 4 positive comments a day without the but, as well as at least 4 hugs a day unconditionally, so they can learn to have unconditional love. And then the 4 S's from Safe, Seen, Soothed, and Secures from the book, The Power of Showing Up. This is to help reinforce that bond between parents, that attachment, to start building resilience, as well as reducing the ACEs that we heard about this morning. And I recommend The Power of Showing Up by Daniel Siegel, as well as Tina Bryson, and 1-2-3 Magic, Raising Resilient Children by Sam Goldstein, who's out of Salt Lake, and Mindset by Carol Dweck. Then number 3, 3 solid meals a day, at least one as a family, no more than 3 servings of meat a week, 3 values to talk about at the dinner table, as well as 3 good things, making sure you turn off all electronics at the dinner table. Then we know that eating, and then I recommend the Canadian Food Guideline. This is an excellent guide. You notice it's water to drink. You notice the massive downplay on the animal products. 85 to 90% of all calories and food on that plate come from plants. Then I'll inevitably get asked you, what about the protein? We consume over 50 billion pounds of animal products or meat in the United States. Those animals need to be fed, and those animals eat 7 times more grain than feeds the whole U.S. population. As a matter of fact, they could go on to feed the 184 or 800 to 900 million people in the world who are starving, not to mention 6 million children who die every year because of starvation. What we eat really does matter and helps feed other people. Unfortunately, those animals that are raised in the United States, all 10 billion of them, and 70 billion around the world, are producing more greenhouse gases than all the trains, planes, cars, boats put together. And here's a conservative estimate of approximately 25% adding to the climate change. The statement, 2015 statement from the AAP on climate change stated that children are uniquely vulnerable to these changes. And the younger they are, under 5, they're even more so, and in the poorest countries. So the ACLM in this paper put out last year stated that, boy, the more we choose to eat a whole food plant-based diet, the more we can free up food to feed others, we can change our climate and make their world better, and, oh, by the way, we're going to be feeling healthier and we can decrease our medical costs. Number 2, 2 hours or less of TV, video, computer, smartphones, etc., and then 2 20-minute sessions of reading. This is, we could spend a lot of time on media, but we recommend how to make family media use plan. And then also, this website, the Gina Davis Institute, talks about equality in our media and helping to make sure that they're portrayed, that women and men are portrayed equally. We participate in the Reach Out and Read program, and we give out a book at every well child exam from 6 months, and over the last 10 years, probably given out 70,000 books. And then we talk about the hidden addiction, and that's pornography. And recommend this book, Good Pictures, Bad Pictures, and there's also a Good Pictures, Bad Pictures Junior for kids under 7 years of age. Recommend 1 hour of exercise daily, and to help so, recommend the family plan to get out and work out as a family. Do 1 daily act of service, no more than 1 sugary dessert a week, and 1 good night's sleep daily. By that, doing 1 daily act, I have kids in my office who are depressed, and I'll ask them, gee, when was the last time you helped someone out? And inevitably, you hear crickets. And so some studies have shown that pre-adolescents who help out others are more popular, they have higher self-esteem, and they are happier. Then the last, almost none, no sugary drinks, juice, soda, fats, oils, processed and packaged foods. These foods we can't even feed to zoo animals. And so I tell parents, gee, before you give it to your child, ask, can I feed this to a zoo animal? And if not, should you be feeding it to your child? And then finally, none on the addictive substances. There are other things that we can do. We participate and opened up a chapter, Walk with a Doc, where we meet monthly and get out and walk. Here we are inside and then outside. And then we found this garden space and grew a garden where our office was and started passing out fruits and some of these tomatoes, etc., to people around. And the excess we also took to the shelter. And then I volunteered at a school called Greenwood Charter School, where we have healthy initiatives, including expeditionary learning, health and wellness, and environmental education. And this year, we're going to try to implement the Blue Zone Challenge. And then I'd like to get started what's called Walk with a Doc, so we can have a monthly potluck. If we can harness, I think the most powerful force on planet Earth is a mother with a cause. Nearly 15 years ago to 20 years ago, a mother nearly brought down vaccines, for heaven's sakes. And so if we can harness the power of moms, we can change our culture. So that brings us to this last point, and briefly, how lifestyles influence our children's lives, present, past, and future. I put that backwards. This patient, she was 202 pounds. She was a 12-and-a-half-year-old female. When I saw her, I would not have talked to her about lifestyle if I had not changed myself. We don't talk about what we don't do. If we're not exercising, we're not going to talk about exercise. If we're not eating healthy, we're not going to talk about eating healthily. And so here we talked to Mom said, gee, what can I do? And I said, well, you need to go on a whole food plant-based diet, which she did. And here we see that she had dropped 30% of her body weight after 2 years. And here's her BMI. She was at a class 2 obesity, and now she's down at normal BMI. This young man, when he came to see me, he was 258 pounds. I've been talking to him about changing his diet. He finally said, "What do I need to do?" And I told him about a whole food plant-based diet. He did that. Within a year, he had lost over 100 pounds. It was 40% of his body weight. The following year, he had gone back up to 178, and the third year, he was still at 178 pounds, 30% of where he was when he first saw me. Here's his BMI. Oh, that's way up there off the charts. Class 3 obesity. He had dropped almost down to a normal BMI, and then when he came back in, he was just overweight, still 30% decrease. As Dr. Greger said, that is the power of plants. Looking then how our past, present, and future, that maternal environment that fetus lives in is so important. If we look at our epigenetics, epigenetic factors can result in alterations in gene expression, which will affect that baby and the fetus and the genetic material in the fetus's ovaries and testes. So not only are our behaviors and our lifestyles connected delicately, horizontally through imitation, but now they're connected vertically through epigenetics and generationally. The Modern Healthcare magazine publishes its top 100 most influential people. They may be influential and doing great things, but I disagree with them. I think the most influential people are you and me. And especially if we're living in this culture, being affected ignorantly and having healthcare problems, etc. And so, men's courses will foreshadow certain ends to which, if persevered in, they may lead, said Scrooge. But if men change their courses, that's supposed to... Am I doing the wrong one? But if the courses be departed from, the ends will change. So let's take a real look at ourselves and our systems. And we can look at our mindsets, biases, blind spots, arrogances, past and current education, all the way down to social norms. And then start to begin that conversation with ourselves. As we do so, we need to change our thinking. As Einstein said, the world we've created is due to our thinking. It cannot be changed without changing our thinking. Once we start doing that and we have that conversation, then and reconcile with our past in this present moment, our future will begin to change all at the same time. As that does so, we'll start to gain more skills, tools, and how to apply those tools. And so we'll go in many different places, and that's how we start getting to what Scrooge said, I will live in the past, the present, and the future. This may represent ourselves, our mindsets, medical education, as we talked about, all the way. This sculpture may represent all those things that need to change. So, Jane Goodall said, we cannot get through a single day without having an impact on the world around us. What we do makes a difference, and we have to decide what kind of difference we want to make, and to the least of these. And all things are delicately interconnected. So, who wants to change versus who wants change? American Academy of Pediatrics just published their guidelines on obesity and obesity treatment. For those in class 2 and class 3 obesity, they recommend bariatric surgery. Those two patients would have qualified for bariatric surgery. Here are the drugs, 5 drugs that are recommended. This is still, and this is really consistent with this editorial stating that look beyond lifestyle, it doesn't work. And part of that is because there's not enough studies in children showing that actually it does work quite well, especially when it's used with the whole food plant-based diet. It is just the same of people falling off cliffs. So our healthcare issues and our healthcare crisis are part of a much bigger, nuanced, complex system that, when we look at it as a whole and try to wrap our brain around it, is actually overwhelming and can be crushing, and will not change solely by lifestyle. However, it will not change unless we start changing our lifestyles. In his book, The Least of Us, The Tales of America and Hope in Times of Fentanyl and Meth, I recommend this is a wonderful book. The author stated, "In the time indeed when drug traffickers act like corporations and corporations like drug traffickers, our best defense, perhaps our only defense, lies in bolstering community. America is strongest when we understand that we cannot stand alone, and weakest when it is every man for himself." Or that could be stated, every healthcare system, every healthcare clinic is for themselves to get as much from this medical pie dollar as we can. Health is the soul that animates the enjoyments of life. The idea is to die young, as late as possible. Children have never been very good at listening to their elders, but may they never fail to imitate us. Thank you.